To begin with, we have to note that the tuberculosis prevention, care and control raise an important ethical and policy issues that need to be adequately addressed. TB is an infection disease caused by the bacteria Mycobacterium tuberculosis. TB disease most often affects the lungs but can occur anywhere in the body. It can be spread from person to person through the air. TB bacteria must be inhaled in order for infection to occur. When a person with contagious TB disease coughs, laughs, or sneezes, he releases TB bacteria into the air. These bacteria can remain in the air for many hours. A person who inhales this air may become infected with TB.
An estimated one-third of the world's population is infected with tuberculosis. One-third. And here's the culprit, the minuscule bacterium called Mycobacterium tuberculosis. But does that mean 2.3 billion people are sick? Fortunately not. Only a small proportion of them actually become sick. To understand why, let's take a closer look at the bacterium itself. When someone with TB coughs, they expel little drops of saliva that fly into the air. Some of them may contain the TB mycobacteria, which can then be inhaled by someone close by. The mycobacteria then continue their journey down the respiratory tract and into the lungs. That person is then infected with TB. And this is where it all becomes a little more complicated. The body detects the invasion and sends out its first line of defense. This includes special cells called macrophages, which engulf the mycobacteria and transport them to the lymph nodes, where they are neutralized. If they're neutralized, the person will have what is called latent tuberculosis. This means they're infected with the bacterium, but they don't have active TB disease, and they're not sick. However, in 5% of cases, the immune system is overwhelmed. The TB mycobacteria multiply and escape, and the person falls ill. This often happens with young children, whose immune systems are not fully developed. In other cases, latent TB can wake up and become active TB. This can happen months later, or even years later, especially in adults with weak immune systems. For example, people who are HIV positive, or who've had organ transplants, or who are undergoing chemotherapy. Once in the lungs, the bacteria may spread via the bloodstream or the lymphatic system to other parts of the body, to the lymph nodes, bones and joints, the digestive system, the central nervous system, the liver, or the heart. So what happens when someone has active TB? Let's imagine the infections in the lungs, as this is the most commonplace. The patient starts coughing, has difficulty breathing, and suffers from chest pains. If these symptoms last for more than a few weeks, and are accompanied by fever, night sweats, and weight loss, the doctor has good reason to suspect tuberculosis. The next stage is diagnosis, and then treatment. The battle is far from over.
Some of the things that TB causes are cough, unintentional weight loss, fatigue, fever, night sweats, chills, and loss of appetite.
What are the symptoms of tuberculosis? It is a pleural effusion, collection of fluid between the lung and chest wall. The symptoms include cough, chest pain, shortness of breath, fever, sweating at night, poor appetite, weight loss.
The first first part of TB prevention is to stop the transmission of TB from one adult to another. This is done through firstly identifying people with active TB and then curing them through the provision of drug treatment. With proper TB treatment, someone with active TB disease will very quickly not be infectious. Also, do not spend long periods of time in a stuffed enclosed room with anyone who has active TB until that person has been treated for at least 2 weeks. Use protective measures such as face masks. If you live with someone who has active TB, encourage that person to follow the treatment. Here I put some real cases of TB and how you can prevent active TB.
All of the people in this video are real patients who became sick with active tuberculosis disease. Their disease could have been prevented with a simple and safe treatment. They all came forward to share their stories with you because they wanted other people to know how to avoid getting sick the way they did.
I came to work one day not feeling well. I went to employee health and, she just sent me home for a normal cold. But then the next day, I started having night sweats and I thought, okay, maybe it's more serious. At first I thought I was going to die. I threw up every day. I was depressed. I was losing weight. I couldn't sleep because if my stomach wasn't hurting, my back was hurting, or I was nauseated all day long.
I went to a clinic to do an exam because I felt very weak. My sight was blurred, and I felt dizzy too. And there they did some x-rays on me.
And there is a safe and simple treatment that can prevent that person from getting sick.
If your skin test is positive, take, the 2 or 3 little pills that they give you and just tough it out.
I don't think that you have active tuberculosis, okay? I think you have what we call latent TB infection, okay?
I wish they would have told me, listen, this is the important facts why you should be on the preventive, and I strongly recommend that you take the medication. If it would have been explained to me like that, I would have probably been more compliant and did the whole treatment.
Certain conditions like HIV, cancer, and diabetes, and certain medications that affect the immune system can increase your risk. You have an opportunity to reduce your risk by taking a safe and effective treatment. You will be followed regularly by a healthcare provider to ensure that you are doing well on the medicine and that you complete the treatment.
Okay, good. All right, you can have a seat over here.